The pandemic has obviously shone a light on many problems in our society, and not least within our healthcare system. As an employee and a Unite rep at the RD&E hospital in Wonford, which is part of my patch, I've witnessed firsthand the dedication of the staff, but sadly, many of them are now suffering from exhaustion, stress, PTSD, and other mental health issues. And mental health is now also becoming a huge crisis among community. I was just wondering, what has the Labour Party learnt from the pandemic, and what do you think that we as county councillors can do to help our constituents?
Yeah.
Thank you.
Brilliant. Thank you, Marina, for your question, and thank you for all the work that you do and for being such a powerful advocate for everyone that you work with, and for being part of Unite and the campaign there. Look, I have been a doctor now for 15 years, and I've worked under a Tory government, I've worked under a Labour government, and I worked through the pandemic, and I couldn't agree more with you. It has been brutally painful for our incredible staff to live through this pandemic. This pandemic has stripped the humanity out of grieving. It has caused people to step up and do things they never thought they would, which is to provide comfort to their patients and their families in full PPE, be the last port of call before someone dies, tell families that they can't come in and see their loved ones, all while not having adequate PPE, fearing for their own health, worrying that they're taking coronavirus home to their families, and losing colleagues because they had a government that didn't adequately protect them, and now trying to rewrite history. And it was an acknowledgement of all of this on top of what 10 years of austerity has done to our NHS and the working conditions that people were already finding themselves in. We all know it wasn't perfect before the pandemic. It was pretty hard going. There was no winter pressure. It was an all year round pressure. We know that staff were having to do extra shifts all of the time to cover for sickness, often due to mental health. And it was very, very difficult. And it was out of that I created the Labour's Care for Carers package in June, where basically we said that there has to be an adequate package of care for our frontline NHS and care workers, but not just if you're a nurse or a doctor, but if you are a porter, if you are a cleaner, if you are a healthcare assistant, whatever your role is, anybody who has worked frontline in our NHS and in our care sector will be liable to be suffering quite badly with PTSD, and there's lots of talk about, doctors and nurses, but if you are that porter sitting outside the intensive care with a desperate family and you're providing them love and support, if you're that porter who's having to take the dead bodies out of the intensive care to the morgue every day, there is no one in our NHS who has been immune from the debilitating, crippling effects of what COVID has done to their mental health, all while having their own family members dying often and their colleagues dying around them. So we put together this package, launched it, and said that what people need is a 24-hour hotline managed by experts that would lead to a package of care that could happen in a hurry, in a real timely manner, because PTSD waits for no one. And you don't have to go to your line manager directly to get it signed off, because we know in the NHS that's part of the problem very often. It's the person that you report to can be the one asking you to do things that you don't feel comfortable with, like go in and clean a room without PPE when someone's just died of COVID. But the government flatly refused to meet. I have an incredible video where in one debate I asked Nadine Dorries, my opposite number, 8 times to meet with me to work cross-party. And she's basically slurred at me that if I want to discuss policy, I should do better at the next election and we should get a Labour government. So that's what we plan to do.